Happy Tuesday. It's me again, Myra. Time for another anatomy lesson. Last week we talked about the forearm. This week we're going to talk about the wrist. And next week we're going to talk about the hand, okay? So if you haven't seen any of the videos, especially the ones we've just been going over, the upper extremity, the shoulder, humerus, elbow, forearm, go back and orientate yourself because you're going to learn a lot of information. Going to be pertinent to the wrist and the hand, okay? Let's get started. So the wrist connects the forearm with the hand. There's 8 bones inside the wrist, and we're going to go over those in just a second. I'm going to show you pictures in a minute, but the names are going distally, distal to proximal, okay? Distal is trapezium, trapezoid, capitate, and hamate. That's distal. They're in rows of 4, okay? So let's reiterate this one more time. There's 8 bones in the wrist. 4 are distal and 4 are proximal, okay? If you don't know what distal and proximal is, go back and review medical terms so you'll understand when I say distal, proximal, anterior, posterior, so forth and so on. You'll know exactly which direction of the body we're talking about, okay? So once again, 8 bones in the wrist, starting distally, trapezium, trapezoid, capitate, and hamate. Proximal, scaphoid, lunate, triquetrum, pisiform. Okay, one more time, from distal to medial, trapezium, trapezoid, capitate, hamate, medial, scaphoid, lunate, triquetrum, pisiform. Okay, those are the 8 carpal bones, as they're called, carpal bones in the wrist. I'm going to turn you around and I'm going to show you a hand x-ray, wrist x-ray, and it will have all of those labeled for you, as well as the distal radius and the distal ulna. Here we go. All right, so these are the fingers. Fingers are up here. We're going to discuss all of these next week. But for now, we're just dealing with the wrist. Okay? So once again, we're going distal to proximal. Trapezoid, trapezium, capitate, hamate, scaphoid, right? Triquetrum, lunate, pisiform. Here is the distal radius, distal ulna, distal ulna. Around. So there's those. I wanted to show you also what if your doctor suspects that you have a tear in one of the ligaments or tendons in your wrist, which is very popular. A lot of work injuries, a lot of typists. If you are working an office job and you just type all day long on your computer, your keyboard's going 90 to nothing, you can get what's called a tear of one of the ligaments. You can also get carpal tunnel, okay? So I wanted to show you what an arthrogram, arthro, one of our medical terms, means joint. Gram is like an x-ray or an exam, okay? What this does is the doctor numbs up a part of the wrist depending on which area we're looking at, okay? For this lecture, we're going to be talking about a scaphoid tear, okay? So they will do what's called an arthrogram. They would take you into like a small x-ray room, like a procedure room. They'd clean you off with some sterile soap, betadine. They would use the x-ray machine called a C-arm. It's like a live picture. They would see where the scaphoid ligament and tendons and all that are, the space they want to put the needle through. And then they'll give you some lidocaine, some numbing medicine. They will inject a small needle, put a small needle inside that space that they recognized on the x-ray. And they will put some x-ray contrast, okay? So I'm going to turn you around. I'm going to show you what the needle would look like on the C-arm image, as well as a little bit of that contrast going in so they can be able to tell if they're in the correct space, okay? Let me turn you around. Here is that C-arm radiograph. This is the scaphoid right here. This long thing right here is the needle. And to verify that they're in the correct space, they inject a little bit of x-ray contrast that lights up on the image. Okay, so that's the scaphoid arthrogram. Now, after that, here is another picture. Okay, this is still, we're looking for the scaphoid space. Okay, and they are verifying that all this contrast here is a possible scaphoid lunate tear. Okay, so all this white looks like kind of like snow is the x-ray contrast. So the radiologist, the doctors that work in x-ray, NMR, CAT scan, that sort of thing, look for the contrast to leak, so to speak, outside of space to determine if there is a ligament tendon tear. In this case, they're calling it the scaphoid lunate space tear. Okay, spin you around. I found that to be very interesting. We do a lot of arthrograms in MRI and CT scan where I work. So I just wanted you to see what one of those look like. Okay. Next, we're going to talk about the nerves in the palm, as well as what the carpal tunnel actually looks like. Carpal tunnel. So I'm going to spin you around again. Here is our image. So this ligament here, that's called the carpal tunnel. Now you have a nerve. We talked about the nerves in the forearm and all the way up to the shoulder. This is called the motor branch of the median nerve right here. Deep branch of the ulnar nerve. Remember, I say every week that we've been doing the upper extremity. Ulna is on the pinky side, the 5th digit. Radius is always on the thumb side. Okay? So palmar cutaneous branch of the median nerve right here. This is the carpal tunnel coming across. Radial artery. It has to be the radial artery because it's on the thumb side. Okay? Down here, ulnar nerve here. I'm sorry, artery there. Ulnar nerve. Median nerve. Transverse carpal ligament. Volar carpal ligament. Right here. So carpal tunnel. Here's the ligament there. And in a second, I'm going to show you where the arteries actually go. Okay? Just keep in mind that the ulnar nerve, artery, vein, everything ulna is always on the pinky side. Everything that's radial artery, radial veins, all of that are always going to be on the thumb side. Now, keep that in mind. Now, we talked about already the brachial artery up here in the elbow, okay, from the shoulder all the way down to the elbow. Elbow is going to be here. This is the forearm, wrist, and hand, okay? So brachial artery is going to branch at the elbow, kind of like a highway, okay? So what do we have? We have the anterior, so we know that's at the front, right? Anterior ulnar recurrent artery right here. Now, if we have an anterior, we have to have a posterior, right? We've been learning that all through our lessons. Posterior ulnar recurrent artery. Common interosseous means between the bone. Common interosseous artery. Recurrent interosseous artery. Radial recurrent artery. And once again, that's right here. Once again, we have the brachial, okay? So we're coming distally. So we have anterior interosseous, posterior interosseous between the bones. Still the ulnar artery here, still the radial artery here, and we're going to come down. It's going to get a little more busy, okay? Palmar carpal branches here and here. Deep palmar branch of ulnar artery, it's on the pinky side right here. Deep palmar arch. Superficial palmar arch. Palmar metacarpal artery. Metacarpal is the proximal bones in your hand. We're going to go over those next week. So once again, here's our pinky, our ring finger, our middle finger, our index finger, and our thumb for reference. So common, palmar, digital arteries, digits, anything digits, digital means the fingers. Proper palmar, digital arteries, here, there, there, and there. On the radial side now, radialis, indicis artery, here. Palmar metacarpal arteries. Princeps pollicis artery. Superficial palmar branch of the radial artery again. Once again, palmar carpal branches, that's where they branch. Carpal, that's what supplies the blood supply, helps supply the blood supply to the wrist. Once again, we'll come back up. Radial artery, ulnar artery, anterior interosseous, because your radius is going to be here, ulnar is going to be here, posterior interosseous, common, kind of where they start, posterior ulnar recurrent, and your anterior ulnar recurrent. Let me swing you around again. So that's the arteries. We talked about the arteries, the carpal tunnel a little bit, as well as the bones, physical bones in the carpals, the bones of the wrist. And lastly, I just wanted to show you the carpal tunnel area one more time in a anterior posterior as well as a transaxial front back, and then top to bottom. Okay, so let me show you the coronal first, then I will show you the axial second, and it will just tell you kind of where the tendons, a little bit of the tendons are, and also one of the nerves. Okay, spin you around one more time. So here is their flat, their hand is flat, just like this. So this is what's going on. This is a left hand. Okay. So here is just a muscle. This is your thumb, of course. Your index finger, your middle finger, your ring finger, and your pinky finger. Okay. Here's a muscle. Transverse carpal. Here, carpal. Median nerve is there. A tendon sheath is here. And the flexor tendon is here. Now this is looking at it from, this would be posterior to anterior. And this would be head to toe. So once again, these are the carpal bones. We're just going to see 4 the way this slice, okay? Carpal tunnel is going to be here. Here's your carpal bones. Your transverse carpal ligament is going to be up here. Your median nerve, follow it up there. Your tendon sheath up is going to be here. And your flexor tendons, all the way up here. So we're looking at these straight on, and then we're looking at the same thing from head to toe. So I hope you've enjoyed our lesson. Next week, once again, we're going to be working on the hand, and I will see you next week. Have a good day.